I'm Dr. Dennis O'Connell, and I'm a professor of physical therapy at Hardin-Simmons University. And I, along with my co-principal investigator, Dr. Jill Jumper, are colleagues from here at the university, along with those at West Texas Rehabilitation Center, are happy to share information about our investigation with you. We've had a long-term interest in resting and exercise blood pressure. In 2008, Jenny Frost, Janelle O'Connell, and I conducted a blood pressure study in the Dallas-Fort Worth Metroplex, and we used less rigorous blood pressure norms than are in use today. Only 16% of that sample had normal blood pressures of less than 120/80. Frankly, that data was alarming and a real wake-up call for us. As you may know, hypertension is the most common condition seen by primary care physicians and leads to many negative sequelae. And we believe it's probably the most common condition seen by outpatient physical therapists as well. Well, since that time, we've become increasingly concerned about our patients' pulse pressure. Pulse pressure is simply the mathematical difference between systolic and diastolic pressures. And there are many, many studies that point out the importance of elevated pulse pressure as a strong predictor of myocardial infarction, congestive heart failure, and mortality. And the importance of pulse pressure actually rivals that of systolic pressure as a predictor of those things. We have not seen any published information on the prevalence of elevated pulse pressures as it relates to our physical therapy patients. And so we thought it'd be worthy to do a study on this topic. So we examined 98 subjects who were enrolled in physical therapy or had just completed it and were in a post-therapy maintenance program. We measured their resting heart rate, their blood pressure, and we calculated pulse pressure. And we used two different age classification schemes. And we also were curious about would there be differences in those who had a hypertension diagnosis versus those that did not in terms of those values. Well, as you might expect, resting systolic pressure increased, but it did so in a significant way in our patients across age. And systolic blood pressure, diastolic, and pulse pressures were significantly higher in those who were 65 years of age or older. Of course, we're facing that as therapists in our clinic. We're finding older and older subjects for patients. 79% and 47% of the sample had abnormal systolic and diastolic blood pressures, respectively, which was just slightly better than our study 15 years ago. So hypertension is still a problem. Pulse pressure was significantly greater in those with a hypertension diagnosis and was abnormal in 36% of the sample. The bottom line, blood pressure in our subjects was not controlled, and pulse pressure clearly is an issue. And as far as we know, we're the first group to actually report the prevalence of elevated pulse pressures in a physical therapy / fitness maintenance sample. What does this mean for our profession? Well, our data supports the call to action for outpatient physical therapists that was made by Severin and colleagues in 2020. As physical therapists, we really must measure resting and exercise blood pressure, and we encourage the calculation of pulse pressure in our patients so we can better collaborate with our primary care providers in combating what remains the leading cause of death in the United States, and that is heart disease. I thank you for listening. Thank you for reading the manuscript. We're happy to communicate with you, so feel free to email us at the address provided in the manuscript. Thank you.